I'm going to dry it off just a little bit. Cover her up good. And now we're going to do, let me see, what we call cold mitten friction. To finish off this treatment, we want to use cold all over her body. And again, it will feel good to her because by now she's sweating really good and she's really hot. So I'm going to take these mittens, put it in this ice water that I have over here. I'm going to pull her arm out, hold it up like this, and I'm going to just give her a real good rub, you know, all over. And as soon as I get that done, I'm going to just put her right back under the blanket. I'm going to do the same thing for her legs. I'm going to uncover one leg at a time, and I'm just going to do her lower leg, and I'm just going to do this. Rub it real good, and it'll get nice and pink, and it really, really feels good to them. And you can dry it off. It'll usually dry off anyway after you've done that under the blanket. Yeah. Now I'm going to sit her up. We're just going to pretend this is bare skin. I'm going to put my mittens back in there, wring them out real good, and now I'm going to do her back real good. And just, okay. Now I've done both arms, I've done her chest, I've done her back. And what you would do at this point, if she's real comfortable laying there, then just let her lay there and let her have a good nap. If not, you can take her and move her to another bed that's all fixed up so that it's nice and dry. But most of the time, this is real comfortable, don't you think, Olivia? Mm-hmm. Yeah, they can usually stay here. Most of my people just stay right here. And I always suggest that they should rest 30 to 45 minutes because I'm a little breathless now because I've been doing the friction. What it's doing is we've just kicked in her immune system. We've just moved the impurities in or out of her lung area that we're working on, and we've drawn a lot of things away from her head and any other area because it'll work wherever things are going on in her body. And so we want her to be able to rest, and we've just kicked in the immune system. So the next half hour to 45 minutes, this immune system's still going to elevate. And so she'll get even a better result if she rests through this treatment. Now, this treatment is good for many things. Any kind of lung congestion, like pneumonia, like various types of flus, bad colds, bronchitis. It works wonderful. It also, in the abdominal area, if you have problems in the abdominal area, whatever they may be, you can use fomentations across the abdominal. For instance, if you have swollen joints, arthritic joints in the knees, the elbows, you can do this very same treatment. Now, you don't do this full body like you see here. You only do the fomentations the way you see me do it for the trunk of the body, which means the chest and the abdominal area. When we do joints, and I'll just show you quickly, let's say this is a really bad, painful joint that she has. Then we would have a fomentation ready, wrapped up, and I keep them a little bit smaller when it's going to be over just a joint area. You can probably do it right in half. Put it inside of one of these blankets. Have a towel, again, over her knee. And I would have socks on her feet because I want to keep her feet warm. If her feet are particularly cold, you can also take a fomentation, wrap it up in a blanket, and you can put it down near her feet. You can put a hot water bottle there or just cover up with a blanket. But now what we're doing now is we're concerned about a joint. So you just do another fomentation exactly like we did on the chest, and you'd put it over the knee. And you would exchange this back and forth with hot and with cold and end up with friction. When you're working with arthritics, they're very painful. It's usually best to put just a cold one, and if you're going to do any friction, just do it very lightly over the knee. Now, one thing to talk about is how many exchanges would you do? For any of these fomentation treatments, you can do anywhere from 3 to 5 to 6 exchanges of hot and cold. The classic one is they do 3 minutes hot, 30 seconds to a minute, you know, give or take, of cold, and they do 3 exchanges. But when somebody's really sick, I've gone and done 5 to 6 exchanges on it. You can also do these treatments, depending upon how sick they are, 2 to 3 times a day. And they will get even a better benefit by doing it more. But if you only can do one time, they're still going to get the benefit, because remember what I said. What we're doing in the joints, what we're doing in the abdominal area, what we're doing in the chest area is we're dilating the blood vessels, and this is so important. I want you to really get this. Then you understand how this treatment works, and you'll know it works. Dilates the blood vessels, and remember what I said it does? Pulls all the impurities, the disease that is in the infected area, let's say her lungs right now, pulls it all to the surface. At the same time, it's bringing in healthy blood that has lots of oxygen in it, lots of white blood cells, lots of nutrition in it to the infected area. So now I'm going to do what? Remember, it's going to put the cold on her body, and it's going to constrict, and it's going to narrow down those blood vessels from this size to this size. And what happens when it constricts? Remember what I said? It's going to take all those impurities that it just brought to the surface, and it's going to take it through the cleansing organs of the body, which are the kidneys, the liver, and the lungs. And you're probably going to say, well, how's the lungs going to help clean? They're sick. Well, what happens with the heat being there, the hot and cold, it opens the lungs up to now do the job they're supposed to do. So it helps to kick out faster the impurities that are in there, the infection that may be there, the bacteria, the virus, whatever is in that area. So the constant repetition of hot and cold is going to exchange that blood so many times and bring that good white blood cells that brings healing to the area, plus lots of vitamins and minerals and everything else that's in the blood, and then bring the oxygen. Remember what I said about joints? Pain in the body, whether it be lower back, whether it be anywhere on the back, whether it be any of the joints, is a high indication that we have low oxygen. So now when you've done the arthritic joint, which is swollen and painful, you know that you've brought in all kinds of good blood, you've brought lots of oxygen in the area, therefore the pain is going to be considerably reduced along with the inflammation, and then we can bring healing to this area. So may God bless you as you apply these treatments to whatever the condition may be. I encourage you to make yourself a little kit that you have ready at all times. You can see on this website, you'll see where you can buy the fomentations, the various things that you will need, or you can just make them, like I said, out of towels. You'll see the instructions so that you'll know what to do. Thank you again for being part of my audience and learning all these wonderful things that'll help you. And remember, your body has to heal. It's not a question, well, maybe it'll work, maybe it won't work. There's no way that these lungs here will not heal after the treatment that we just gave them. Thank you.